Hi, I was recently asked, what's your method or approach for weight loss? Hi, I'm Dr. Ron Rigby. Today we're going to talk about how I approach this problem. A lot of times I'm looking at your risk factors. That's why we have you fill out a lot of paperwork before you come in. When did you start gaining weight? What were the factors going on? Was it a medication that you started gaining weight with? Was it in a pregnancy? Did you gain too much weight in pregnancy? Did you give birth to a large baby? Physical characteristics. Do you have high blood pressure? Do you have high cholesterol? Or where's your triglycerides? Do you have fatty liver? So I'm looking at those risk factors first. Second, I look at your family history. Family history can have some ties to it, but just because your family had it doesn't mean you're going to get it, puts you at slightly higher risk of going down that pathway. Then I also look at medications that we as providers have put you on. They're trying to solve problems, but solving one problem might cause another problem. I look at everything from the aspect of I'm trying to get you to lose weight. Things led to this point. Could be choices, that could be medications, could be genetics, or it could be environmental factors, or what we call epigenetics. Everybody's journey that got them here is not the same. Males and females are not the same. I'm trying to look at all those different factors so I have a better idea of what we need to do. I do a lot of blood work, and I do a lot of blood work to kind of see what's going on inside of you. The lab work gives us a general idea, but that's where I'm looking at your risk factors and what the lab work shows. Some of those labs could be totally normal, but there could be other labs that make me think maybe those labs aren't totally normal. I'm looking at everything trying to solve insulin resistance. And if you have lots of risk factors, even though your insulin level might be good in your labs, it doesn't mean you don't have insulin resistance. And I'm also looking at your different challenges. If you have some compulsive eating or binge eating or night eating, that's an issue. In fact, I've had multiple patients come in, and when they have problems, I'm going, have you ever talked with anybody about this? They're going, nobody's ever asked. I'm asking questions to try to figure out what's going on inside of you, what got you to this point, so I can get you hopefully going the right direction with the least amount of medicine if possible, because there's different lifestyle things we can do. And a lot of times we go straight to the exercise. What about sleep? What about fuel? What about breathing? What about these different things we can do? But if your hormones are out of whack, we need to focus on that also before we just go throw a bunch of medicines. We're trying to solve problems one at a time. I'm looking at trying to fix insulin resistance. Maybe I'm also looking at thyroid, maybe your sex hormones, maybe your gut hormones. So that is my approach. I'm trying to optimize lasting weight loss, trying to come up with a plan that you can do long term to keep us going the right direction by improving your metabolic health. Take care of yourself.